Can ulcers cause back pain? Is one among the less common symptoms of peptic ulcers. Here is a brief overview of ulcer symptoms that may include pain in the back. Ulcer symptoms. Abdominal pain. The most common symptom of a peptic ulcer is abdominal pain, which may be relieved with food consumption. The pain is often described as a burning or gnawing sensation, or as a feeling of hunger. Such pain is a classic symptom of duodenal ulcers. Ulcers and back pain. In some cases, abdominal pain caused by ulcers may radiate to the back and result in mid to low back pain. Usually, such pain lasts for a short duration, but some people experience intermittent back pain for a few days or even weeks. Excruciating and persistent back pain could be a sign of a perforating peptic ulcer that penetrates the pancreas. Other symptoms. Apart from the pain in the abdomen, ulcers may also cause loss of appetite, weight loss, bloating, nausea, and vomiting. More serious symptoms are vomiting blood, frequent abdominal pain, blood in stools, etc. Ulcers may cause internal hidden bleeding, which can lead to anemia, fatigue, and shortness of breath. Some people may not experience any symptom at all. Such silent ulcers are usually seen in diabetics and elderly people. Those who are using NSAIDs for a long duration may also have such asymptomatic ulcers. Thanks for watching. Subscribe to get more tips.